Okay. Oh my gosh. We're doing the cervical spine and neck evaluation. First, we do the ABCs, checking for airways clear. She's breathing and she has circulation. Obviously, all those are good. Then we do a past and present history, so sample and OPQRST to start question the patient. Then we do inspection. We're checking for swelling, discoloration, deformity, and then palpation. So first, we're going to palpate the bony structure. So go ahead and turn around. And the first thing we're going to palpate is the spinous processes. So that's right here. Looking for the vertebrae. C7 you should probably feel because it's the biggest. And then the transverse processes, which are located here on the side of the spinous process. And then the occiput, which is the bony part on the posterior part of the head. And then you can go ahead and actually stay like that. The trapezius muscle, we're going to do soft tissue now. So the traps, palpate the trapezius here. Okay. And then the paravertebral extensor muscles, which are like here. And with these, we're checking for strain and contracture. Go ahead and turn around. Face the camera, yep. And then the scalene muscles, so it's like sheet muscles. We're checking for strain and contracture. Then the sternocleidoid mastoid muscle, which is like right here, the big muscle, and you're checking for strain and contracture. The cartilage, located right here, just checking for enlargement. Then the lymph nodes. Checking for enlargement again, okay? And then the range of motion test. So we're going to do passive range of motion and active range of motion. You do either one. So go ahead and do flexion. Nice. Now do extension. Nice. Now rotation left. Good. Rotation right. Nice. Lateral bending left. Lateral bending right. Okay, now we're going to do the strength test, the restricted range of motion. So go ahead and do flexion. Go ahead again. Nice. And that is checking for the sternocleidomastoid and anterior scalene. And then now we're going to do extension. So go ahead and extension. Nice. And then you can do full range of motion one. Go ahead, extension. Nice. That's the cervical, paraspinals, and trapezius and the levator scapulae. And then we're going to do rotation to the left. Go ahead. Nice. And then rotation to the right. Nice. Okay, and that's checking for the contralateral sternocleidoid mastoid and the trapezius. And then lateral bending left. Nice. Lateral bending right. Nice. And you can do all of them to where she puts all their strength in to try and move in the motion. And that is for the ipsilateral scalenes and the sternocleidomastoid and the paraspinalis. And then we're going to do the motor test. So go ahead and you can do your right arm. Yep. Nice. That's the deltoid C5 and then C6 bicep. Nice bicep. And then extension for C7, the traps, trapezius, triceps. Good. 8. C8 is the finger flexor. So go ahead and flex your fingers. Nice. Then after the motor, do a sensory check for the neurological test. And then we're going to do C5, which is the deltoid. Nice. Sensory there. Go ahead and show your hand. Open your hand up. C6, the thumb. C7, the middle finger. C8, the little finger, the pinky. The medial elbow, T1. And then we're going to do the reflex test. So C5 is the biceps tendon. So just relax, and then you hit them here with the reflex hammer, and if their arm goes like that, biceps biceps all good. Then once you turn, turn, and then you do the triceps. You hit here with the reflex hammer, and their arm might go this way. And then that's C7, and then the C6 is the brachioradialis. So go ahead and relax, and then you would hit here with the hammer, and their hand might jolt up. And then we would do the, go ahead and face the camera, the blood flow test. So we do the carotid, the carotid blood flow test, so the carotid pulse, and the radial pulse, and we compare bilaterally, so we do both sides, both arms, and we're looking for rate, strength, and rhythm, and then the blood pressure test, which we can't do. Thank you.